So the disadvantage is, like everything else, nothing's perfect, all right? So immediately after you take one, you reach your plasma levels and full amount of anticoagulation, but immediately after that, they start to be eliminated from the body from various mechanisms, whether it's renal excretion or some hepatic excretion. They get eliminated quite quickly, and usually their effect is gone within 12 to 24 hours. So the bad thing is unlike warfarin that hung around for days, if you don't take your medications as they're prescribed, you put yourself at risk for clotting complications. And so that's, I think, the biggest downside of these agents is you need to be persistent in how you take your medications. So there's strategies. I think most of the pharmacists are aware if you build things around routine daily activities. If you have your medications with breakfast in the morning, put your meds on the breakfast table. If you take them when you're having an evening meal, put them on the dinner table, but somehow weave them into the daily activities that allow you to be adherent to the medications. Now, the last thing that most people have pointed to is the fact that we don't have a reversal agent. Now, we truly didn't have reversal agents with warfarin. We would reinitiate the metabolic machinery by giving patients either oral or injectable vitamin K. With these agents now, up until October, we had no reversal agents. The first monoclonal antibody to bind to dabigatran and basically stop its anticoagulant activity is now available, and we have it in the hospital. So if someone comes in with a major bleeding event that we need to control, or if they need to go to surgery urgently, we can give that agent and reverse dabigatran within a few minutes. The reversal agents for the other agents, like apixaban, edoxaban, and rivaroxaban, is in the works right now. There's an exciting agent called Andexanet that acts as primarily a decoy, attracting these agents to bind and eliminate their anticoagulant activity. And then finally, there is another molecule, seraparantag, that's in its early development that may not only inhibit some of the oral agents, but it may have a role in some of our older injectable agents like low molecular weight heparin, fondaparinux as well. So stay with us, stay tuned, all right? And I think within a few months, we'll see the introduction of more reversal agents, and the last problem that many people have cited as a potential complication will be eliminated.